It is very significant in that this drug gives you 6 months of protection after 2 doses, whereas existing medications would give you 2 months, and then we have the oral options that have been around for a while that rely on the patient really taking a medication by mouth every day to be effective. So this is a game changer. This drug, just based on the large clinical trials that were done, shows the greatest efficacy during the trial for these types of medications, where the efficacy is at around 99.9%, so extremely efficacious. We still need to see more data in terms of real-world effectiveness, but it's very reassuring, and definitely it's beating the daily medications, the regimens that we've used now for almost close to 10 years now. So in terms of accessing the medication, the individual has to have an indication for pre-exposure prophylaxis, and then they, with their doctor, should have a conversation around options. The options could be oral, could be an injection that gives you 2 months of protection, or could be these injections that are 6 months of protection. It would depend on the conversation in terms of accessing that. Currently in town, in the Seattle area, there are several practices that have it available. We at UW Medicine are planning on launching this in the coming months. It sounds similar to a vaccine in that I get a shot and then I get protection. But unlike a vaccine, there's no antibody formation here. So this is basically a very long-acting medication that acts to prevent HIV. And again, it's for 6 months, and it would require to continue the administration for subsequent doses. Whereas a vaccine, typically like the flu vaccine, is good for a year, and then you get another shot.